I was born in Nigeria, and my parents left when I was about 5 years old to go to college in the US. At the time, they didn't know that I had a heart condition, but I was always sick. I found out that I had a congenital heart defect called Tetralogy of Fallot. After my surgery, I could tell something was not quite right, but I couldn't figure out what it was. I couldn't do anything about it.
Congenital heart disease is one of the most common birth defects. It occurs in 1 in 100 live births. 1 in 4 of those heart defects is a critical congenital heart defect that requires heart surgery in infancy. A physician needs to be cognizant of the surgical repairs that they had as a child, but also with the adult condition.
When I first met Dr. Louis, I just felt like he was a very gentle person. I was used to doctors coming in after reading your file, telling you what they saw and so forth. That was different with him, I'll be honest. For the first time, I felt like, wow, this doctor sees me as a person, not just a patient.
When Uduak came, she couldn't do the things that she loved to do on a day-to-day basis. We had the expertise in our cardiac surgeons to devise the right repair for her and do it at the right time.
For the first time, I felt like I was empowered to make my own decisions and not just look at doctors to decide for me. With everything going on with COVID, I actually feel comfortable going to Stanford because I know how diligent and how precise they are in terms of their care.
We really made that a priority here at Stanford, made sure that our patients were in a safe environment where they were social distancing, wearing masks universally across the healthcare system. We're the ones that can finally offer that next level care for them and be able to repair their hearts.
I'm doing the things I used to do, but not feeling fatigued or swelling, having to stop, or feeling dizzy. So it's like a new me.
There's no restriction to what they can do if we walk with them and provide the care that they need.